know, and we have to assess.
Dr. Price, can I ask you a question? I have a lot of people, especially in my clinic, that come in because I see a lot of younger and a lot of older women, but usually the younger women saying, hey, I've noticed my mom is forgetting some things lately. I've noticed that I've had the same conversations with her, or, a slow decline. A lot of patients don't know what the first step is in kind of addressing their parents aging. And a lot of times I know it's a hard subject to broach with them because they get defensive. Oh, you would be forgetful too if, So what would be the first steps for somebody who's kind of going through that aging process with their parents and starting to see changes that might necessarily not be that overt, but...
Yeah. So the first step would be to see their primary care provider and get some screening tests done. You can do memory screenings very quickly, assess for depression and other things that can cause changes in memory. Look at their medications because that can sometimes affect your cognition. And then if they find abnormalities, then doing a workup with lab tests and MRI.
Is that something that the PCPs and over a certain age they check for?
Well, that's a good question because it's something that has not been recommended on a routine basis till now. Mm-hmm. And now a lot of medical centers are doing routine screening of everybody 65 and over with just a quick memory test and a depression screen, annually. And then referring that, hopefully the primary people can do the workup themselves, and then, if needed, refer the patient to a neurologist or a geriatrician, sort of depending on the situation.
Sorry, can we go back a little bit for the orthopedic surgeon here? And maybe I'm going to ask a more basic question is, what exactly is dementia?
Well, so dementia is a condition where there's loss of memory and cognitive abilities, which is severe enough to impair functioning. So you're not able to take care of yourself. So it's an extremely common problem. It's about 10% of people over 65 have dementia. And as we get older, our risk for dementia increases. So by 85, about a third of people have dementia.
Wow. Does family history play into that too?
Sure, there are, inherited types of dementia, Alzheimer's, certain types of Alzheimer's disease.
So that's another question.
A good question.
I understand that Alzheimer's and dementia, although both dementia, they're different.
Well, Alzheimer's, so dementia is an umbrella term. Okay. And Alzheimer's is one of the things under the umbrella. So there are many different types of dementia. Alzheimer's is the most common one. And then there's frontotemporal, vascular, Lewy body dementia, Parkinson's dementia, and there's a bunch of other more exotic ones.
Wait, sorry, I didn't quite understand. So Alzheimer's is a specific type of dementia?
It's a specific type of dementia.
And why is it? I don't understand why that's differentiate.
Because the pathophysiology is different. So in Alzheimer's, that's defined by the presence of plaques and tangles in the brain. Okay. So certain proteins that deposit in the brain.
So you mean regular, just non-Alzheimer's dementia doesn't exhibit those same pathophysiological
They have different
things?
types of proteins that we're finally figuring this out. But so there are different types of mechanisms for the different dementias.
So up until now, until recently, these were clinical diagnoses, right?
Yeah. Right.
You really couldn't tell unless you did an autopsy. And checked the brain out under the microscope after death.
Yeah.
But I think what Susan was about to say was now we do have some ways to differentiate types of dementia.
And what would you say? I've always, I have kind of a simple mind, and I always thought that dementia is not necessarily abnormal, but it's just part of the aging process.
That's not true. So a lot of people think that. There are changes in our memory and our brain as we get older. It's harder to learn new things, but then we have wisdom and other advantages that we have. There is a condition called mild cognitive impairment, which is defined as somebody having memory loss, but it's not impairing their functional status. So they can still pay the bills, drive their car, and so forth. But some of those people progress to dementia. And right now, I think the estimates, there's about 6 million people in America that have mild cognitive impairment from Alzheimer's disease, which may progress to Alzheimer's disease.
Do you see any differences in Hawaii specifically for dementia and the types of dementia or people getting dementia?
I think
Less or more?
Maybe more vascular dementia.
Probably more vascular
Yeah.
or mixed dementia. So you can have
Mixed, yeah.
Alzheimer's dementia and vascular dementia. You can have combinations. Yeah.
That seems
Why
to be
is
more
that?
common. Well, it seems to be more common among Asians.
Oh,
Yeah.
a vascular dementia.
I read somewhere that there obviously are racial differences in the incidence or the commonality of dementia, right? And they were saying that Asian people is relatively it's lower than like say white people. Is that correct?
I'm not sure of the kind of age-specific differences. I'd have to check that.
Yeah. I don't know if I've seen racial changes, but I mean, just in terms of longevity, right? If I look at all my 90-year-olds, they tend to be Asian female.
Yes,
Yes.
right.
So there's some, I mean, like Polynesians, I rarely see.
Yeah.
Live till
Live
90.
to that age,
Yeah.
right?
So there's that kind of bias, I guess.
Sure.
Right? But there's other things like education. So, Dr. Price mentioned, your primary care physician can do a screening test.
Mm-hmm.
Some people who are highly educated will do 30 out of 30 on their mini mental status exam, which is a common screening test that primary care physicians use.
Okay.
But the daughter may still say, hey, but
Something's not right. Yeah.
And usually that gut instinct ends up being true. And you'll see with time that patient does develop dementia.
Sorry, what is this mini mental status exam for the listener? What is that?
It's
Pencil ball thing. What was it? Pencil ball penny?
There are a number of screening instruments. The mini mental status exam has been around for decades and decades. It's patented.
It's now patented.
Oh, is it?
Yes, but it's a total score of 30. So and it tests short-term recall, language, calculations, visuospatial.
And you use this test specifically to help you make the diagnosis that somebody has dementia, correct?
Yes, but it's not. You can't just
It's
base
a
it on
clinical
memory alone.
and,
right. Yeah.
Well, I bring up that test because that's probably the most common test that's being used by primary care physicians. I mean, we learned it in medical
Yep.
school.
Yes.
Right? So it's a real basic tool. But what I'm saying is, depending on your educational level and,
Yes.
and your English is a second language, I mean, there's a lot of
Yes.
different
Yes.
things
factors.
That could make you do better.
Or
Yeah,
worse.
exactly, or worse. Yeah. So, so if someone says my mother has some mild,
Something's going on.
and we say, hey, you should take this, have your primary care physician do this test. Just because she scores a perfect score doesn't necessarily mean
True.
there's no intervention should happen.
And when that happens, we can refer someone for neuropsych testing, which is it's about a 2-hour exam that's done by a psychologist that's trained in that.
It seems like it's the difference between functionality and being functional and not being functional. Just a little cognitive impairment versus dementia, which is
Dementia requires the loss of function.
got it.
Right.
So wait, I just want to be clear about this. So I still, in my very simplistic mind, say that everybody, if you get old enough, you're going to have some form of dementia.
No,
That is not true.
That is
because-
not true.
That's surprising.
So, it's like arthritis. I tell people,
You're
there
gonna
are
get
no 70-year-olds without arthritis. You're gonna get it, but whether or not it's so bad that you need surgery is a different thing. But arthritis is certainly a non-preventable form of aging. The only way you can prevent arthritis is to die early, right? So my patients always ask me, well, how do I stop this? I'm like, well, you could die early and you won't get arthritis.
we should tell that to our patients.
But it's true. If you die early too, I mean, back in the olden days when people died in their 40s, nobody knew about dementia.
Because there
You
weren't.
didn't live in. That's
You didn't
why-
live that long.
That's my point. Is
Are
that
there
if you
any
live long,
things that
no?
people can do to prevent?
That's a good question.
Or
so
help to-
there's been a lot of studies about that, and some recent ones that are coming out that show benefit to certain lifestyle changes. So healthy diet, heart healthy diet like the Mediterranean diet or the Mind diet, exercise, aerobic exercise and some resistance exercise, mental activities, so cognitive stimulation, reading, games, that sort of thing, and then socializing. So socialization, that's really important for
Keeping
to
the mind
keep our
active.
mind going. Yeah.
You mentioned resistance training, like weight training. And it seems like there's more and more information that form of exercise may actually be even more beneficial.
Yeah, I'm not sure of the data there, but the latest recommendations I've seen is, 3 days a week where you do aerobic exercise for half an hour and then including some resistance. So I don't know the...
Yeah. I always tell my patients, what's good for the heart is good for the brain, right?
Oh, yeah.
Because...
Yeah, that's what I tell my patients too.
Exactly. I mean, I think...
Go ahead.
More cholesterol level or vasculature, blood flow, anything that increases blood flow to the heart and the brain, like aerobic exercise, I think is, probably helpful.
Yeah, I guess we have different things, right? But for my patients that I see for hip and knee arthritis, the problem is mobility, and I always tell my patients that there's a few things you can't avoid, right? You can't avoid getting older, and as you get older, the problem is you get physically, functionally weaker, right? And the only way to really keep your muscle and to keep your strength is to do some kind of resistance training, because we all know the guy who rides the stationary bike for 1 hour every day or goes walking. Walking might be good for you, but it does nothing to get you stronger. And the problem I see in older folks is they just get weak. So,
Walking, isn't that good for osteo?
but it's good for everything, right? It's good for your muscles. It's good for your... same like what you tell your patients. What's good for your heart is good for your brain. I tell them what's good for your muscles are good for your... You know what I mean? It's probably good for your brain as well. I'm sure that's probably true, but... I see that in our patients that fall and have hip fractures, right? If they're in decent shape, their recovery is so much better.
Faster, yeah.
Right? If they're just weak, now you have a broken hip and you're even weaker, right? And the only way to combat weakness is with some type of resistance training. So... Well,
I totally agree that lower extremity strength is very, very important, because when people ask me, what sort of things lead families to put their loved ones into a nursing home, because nobody really wants to go to a nursing home at the end of life, right? But I think to me it's two things, right? One is dementia, a dementia that's so severe that they don't even recognize who's helping them, their family member who's, and you don't get that feedback that your dad doesn't even know who I am, and, that kind of thing. But the other is mobility. Once you lose your ability to walk or even transfer, and you might be only 70 pounds, but 70 pounds of dead weight, you're messing the bed every day, right? Someone's going to have to carry you out and clean the bed sheets. They can't even transfer to a wheelchair, or, you know what I mean? So that's, I think, really an important factor.
Once you're in a nursing home, are you there forever? Or are there any chance that you can go back?
Well, most of my patients are here short term, right?
Oh, okay.
So they're there for 3 or 4 weeks.
Post-surgery, like
just post-surgery.
Post-stroke, whatever. But a certain percentage of them do
are
end up
long-term.
Long-term, right? And they don't necessarily need to stay in a nursing home, but they might go to a community setting, like a foster home.
So there's different acuity levels of...
Right? And it depends on what you can afford. Right.
And what the care needs are.
And what the care needs are.
What does insurance look like for that? Are those types of places covered? No?
Yeah.
Completely out of pocket?
Not unless you have long-term care insurance,
Wow.
which...
So the very rich, I think, can take care of themselves, right? They can go into a kahala nui.
Right.
How
much do those places run? Do you know? Just ballpark, maybe?
So a care home, I think, care homes, which are, small residential homes, they're all over Oahu in our neighborhoods, usually at most 5 residents. Those range from $5,000 to about $16,000 a month. $5,000 is really low. So, and I think that might be an old number.
Well, the foster homes that are in traditionally Filipino neighborhoods like Waipahu, Kalihi, Eva Beach, those still go around $5,000 to $8,000. Care homes that are more like in Manoa, Kaimuki, those are like 8+.
Wow.
Right? But nursing home is, I mean, just a nursing home bed in any old nursing home is about 10 to 15,000 a month.
Oh my goodness.
So care home is cheaper.
Yeah.
You know?
Yeah. How do you guys kind of, when you talk to the families, how are they paying for care?
So like I said, the very rich can go into a super nice care home in Manoa or a Kahalanui.